Good evening and welcome to the August 19th board meeting of the Oakland Community Health Network. At this time, if you are able, please rise for the Pledge of Allegiance. Pledge allegiance to the flag, republic for which it stands, one nation, under God. Please take a roll of the board members.
Mr. Young.
Here.
Mr. Furman.
Present.
Dr. Giles. Pastor Jones.
Present.
Dr. Guadalupe.
Here.
Dr. Hans.
Here.
Ms. Newman. Ms. Root.
Here.
Mr. Smith.
Here.
Mr. Cowan.
Present.
We have a quorum.
Thank you. At this time, we have need a motion for approval of our board meeting agenda.
So moved.
Support.
Any discussion? All those in favor say aye.
Aye.
All those opposed, the motion carries. At this time, we have the first opportunity for public comment. Once you are called up, I do have some folks that have signed up for public comment, and I'll call them up. Also open it up if there's anybody who came in a little bit later for an opportunity for public comment to the board. We would ask that you limit your comments to 3 minutes. State your name when you come up, and we look forward to your comments. But before we start public comment, I wanted to ask Dana, our executive director, to make a short statement.
Thank you. Good evening. Had a little echo. Thank you and welcome to our board member meeting, I should say. I did want to talk about something that's come up and came to our attention. So over the past year, under the direction of Michigan Department of Health and Human Services, OCHN has been engaged in a transition to assume the fiscal management services for self-determination. This transition is an important step in ensuring greater accountability and consistency in service delivery. As we continue to align with the technical requirements established by MDHHS, OCHN remains committed to ensuring that all programs meet these requirements. It's important to note that CLS community living supports services have not been reduced under OCHN's oversight. To comply with MDHHS self-direction technical guidelines and to safeguard program integrity, adjustments have been made to ensure that programmatic costs are included in such as workers' comp, earned sick leave, employer's tax, etc. These adjustments are not reduction in CLS rates, but necessary to ensure that self-determination programs operate within the accordance of the law. OCHN is committed and remains committed to being transparent, being accountable throughout the process, and will continue to work closely with our providers and the community to ensure that individuals and families continue to receive the support they need. Thank you.
Thank you. So at this time, we'll commence with the first opportunity for public comment. And I apologize in advance if I mispronounce your name. I'm going to do the best I can. First, I have Justin Thorne. Yes. Are the mics on? Yeah.
Thank you. I'm here this evening to advocate for maintaining pay for long-time community living support and respite staff, the foundation for everything we do for individuals with developmental disabilities. I attended a recent OCHN advocacy work group where one of the foundational things we talked about was how to retain and maintain staff who choose this profession as their career. And I'm here to tell you that the answer is not what has taken place over the last several weeks. Cold calls from GT Independents with staff being told that their staffing rates will be reduced, that their contracts will not be honored, that the hourly pay they've made for years no longer fit a budget tool that OCHN has created. I wrote in my notes that there's been no memorandums or no bulletins or no official word regarding this from OCHN. I appreciate your comments earlier, but I would like to point out they are the first official comments on this matter that have ever been posted, but families in this room have already been called by GT Independence and have already been told to accept lesser rates. Whether those rates are factored in with other things is immaterial to the fact that the people providing the service will make less an hour, for some of them as much as $4 less an hour. Medicaid law requires that a spending plan meeting is held when a self-determination budget is set. It also requires that a budget is sent to the family when a service is authorized. To my understanding, no budgets have been sent by OCHN to any family since April 1st, and I can speak for my families where none of them have received one. So there are families here tonight who have come to advocate for themselves because we still believe in partnership between OCHN, our core providers, and the families. We have not forgotten that OCHN acted first during the COVID-19 pandemic and raised staffing rates. We remember that OCHN, in collaboration with the greatest core provider this county has ever seen, Community Living Services, has led the nation in supported employment over sheltered workshops and having leaseholders over licensed homes. So we would like to gather here and ask you for this compromise. First, that existing staff, those that have chosen this as their profession, have their rates be grandfathered in alongside these budget changes. And secondly, we ask for transparency regarding upcoming budget changes to self-determination services as required by law. Now, I understand I came to the town hall yesterday and that you guys are challenged with the RFP and the state's changes. And there are people in this room who are incredible advocates who would like to gather and support you. But we cannot make it to walk a mile if the people who want to go do not have staff. So I ask you to reconsider the changes that you've made to the pay rates for staff. Let us come together and try to save mental health services in Michigan. Thank you.
Next is P.J. DeCour. Absolutely.
So,
Thank you.
are you ready? All right. Why don't you want to tell who your staff are?
My staff are James, who is here, and Tammy, who is not.
Okay. How long has James worked for you?
7 years.
Okay.
And Tammy's worked for me for 3.5.
Great. How do you think you're doing with your goals?
I'm doing better than I ever have because I have a job now.
Yeah. You have a job. You've worked on all your goals. And what have you won any awards lately? Go ahead. You came here to win an award, right?
I came here to win an award, yes.
Yeah.
Okay.
Achievement champion.
I won an Achievement Champion Award here.
Yeah. And you also told me earlier you won Employee of the Month at Rochester Library.
Yes.
Yeah. What do you think will happen if your staff rates are cut?
I definitely think Tammy will probably leave, and I'll have unstable staff after that because no one can trust that the rates will be what their contract says they are.
Is there anything else you want to add? All right.
No.
Well, thank you so much, PJ. All right, thank you.
Thank you. Maureen Guy.
Thank you for listening to me today. My name's Maureen Guy. My husband Rob and I have a daughter, Carly, and we've been with CLS for almost 20 years. It'll be 20 years next year. Since we first started working with CLS, the message from them has always been self-determination, supported independence where appropriate. And we've taken that to heart, and Carly is looking forward to, sometime in the next year, moving into a house with friends, with support. And right now, Carly has a support person, and I was called by GT this past couple of weeks ago, and summarily told that going forward, our support person, who Carly only has for 4 hours a week, her support person would be making $2 less, which is a 10% pay cut going forward. That there's a flat fee that they're going to pay support people, and that flat fee takes into no account experience, education, or any of the other things that generally your salary is related to. Not to mention, she's been our support person for several years. How do you expect a person who has grown up basically with the mission of getting out and being on her own in supported environment, where are we going to find people who are going to work for that flat fee that was raised during the pandemic, but we were given the understanding that that was going forward, that's going to be the norm. So the other thing I want to say is it's unconscionable the way this was handled, that GT called our house and just said, here's what's going forward. Your person's budget won't accommodate the rate of pay that she had, a budget I'd never seen, nor had I heard of it, and we had just finished a new IPAS the week before with CLS that had nothing in it regarding a pay cut. The fact that there was no notice to me or to the person, there was no like forewarn, and I pulled out all my little CLS flyers that have been sent to my house and my OCHN flyers that said there would be no change in services. This is kind of a change. So I'm just here to say, not only is this unfair and inappropriate, but it's unconscionable how it was handled. And I was told I need to sign a new agreement, and I'm not signing it until we find out if you guys are going to be honorable and grandfather in, at the very least, the people who count on this income. Because, I mean, we can't live without our support person. She's fabulous. Goes way over the top for our daughter. And I just have to be on record with this. Thank you.
Thank you. Joy Wilkins.
Good evening. My name is Joy Wilkins. I represent my brother and my sister with intellectual and developmental disabilities. For their health and safety, they require 24-hour direct care support to live independently in our hometown. The changes that OCHN has implemented for self-determined individuals has caused a disruption to the entire delivery system. The idea that a person has a choice and an individualized life plan is non-existent. It just isn't reality. Self-determination can only work well in a managed care system if there is true collaboration and clear communication by OCHN with the families involved. Unfortunately, that has not been our experience. I'm here to discuss my dissatisfaction with many of OCHN's recent decisions that have impacted our family. First, taking financial management services away from CLS has made it impossible for us to have the documentation we need. For example, this one-page budget that CLS provided us with every 6-month periodic review of the IPOS was a great document. I've asked OCHN and GT for a similar document. I've been asking since May. All I'm looking for is a document that says the authorized services, the units, the dollar amounts, the total for the time period, so that I can properly and responsibly monitor my siblings' budgets. I was told that OCHN's self-determination team does the individual initial budget and that GT Financial tracks and monitors the budget. I have not yet received an initial budget for the current IPOS period, which was effective April 17th. Since GT took over, now I, as the guardian, have to sign off on timesheets every 2 weeks for the employees of our home care agency. Now that's ridiculous. OCHN told families that when the FMS switched, we would not have to worry about any disruption in service. Our care providers have had so many issues, from not getting paid to direct support professionals not getting paid the appropriate rates, having to fax timesheets that were once electronically uploaded into OCHN. So needless to say, this has been a very rocky transition. In lieu of time, I will simply list my other concerns, as you've likely heard them from others and will continue to probably throughout this evening. Inconsistent and reduced rate of pay for direct care workers without notice, administrative red tape within OCHN departments, transportation cuts and unrealistic transportation reimbursement rules, support coordinators not having the appropriate information to do their jobs because there's too many agencies involved, hoops for support coordinators, hoops for support providers to jump through, wait lists for skill building programs, and direct care service worker shortages. I feel like we're moving backward. My parents would always tell me that our family would never leave Oakland County because of the amazing care and services that my sister and brother would receive here. I hope that someday we can be proud to say that we stayed in this community because it is the best place for a person with disabilities to live, and always moving forward.
Thank you. Kathy Ruski?
There we go. Good evening. My name is Kathy Remski.
Sorry.
That's okay. I probably didn't print very well. And it's going to be difficult for me to add anything that the previous speakers have spoken to you all about this evening, but I'm the parent of 2 adults with developmental disabilities who I am so proud to say are living in a supported situation together with support staff, some of which we've had consistently for 4 years. They are amazing. And I'm going to speak a little bit more about the emotional side of this than I am the tactical and the administrative side of it, because my kids actually do very well. They're not very high need, but for those people who have a much greater need, I cannot imagine being able to find staff that is working for the wages that are being proposed here tonight. There are individuals, I'm also part of an organization called SAIL, Solutions for Adult Interdependent Living. We're an organization that was started by 10 families 7 years ago to try to find solutions to have families have their children live independently or in supported situations. we have had a roster of up to 200 families be part of SAIL, where we encourage families to create community. We tell them over and over again, you'll be able to find staff. Don't worry about that. You will find staff. At this point, I can honestly say I do not believe that I can tell people at the reduced wages that are being proposed that you will find staff, especially for the highest need population. They won't find staff. We should be looking to elevate this group of individuals, not decimate it. We should be looking to accredit them, to give them every tool, to give them technology, to give them anything they can. These people should be elevated beyond. I mean, if you look at families who are trying to figure out what happens when they're gone, a staff is a critical part of that. To take these wages, you're just not even going to be able to look at a situation that requires staff. You won't find it. It's already difficult to find it, and now we're going to look at wages. Again, we should be elevating these people. We should be giving them classes to make the profession attractive. We should accredit them. But instead, like I said, we're decimating them. I'm fortunate to have had staff with me for several years. That hasn't always been the case. Turnover before 4 or 5 years ago, when wages were elevated, was ridiculous. So I implore you to listen to the people that came before me, and I also urge you to keep at least the wages of those who are currently working where their wages are, and to seriously look at not changing wages for anybody in the future. These families won't have hope. They just won't. They won't have an answer to what happens when I'm gone, because there won't be anybody to help them out. Thank you for your time this evening, and I really hope that you take a lot of what you've heard tonight, walk away and think about it, and change your direction. Thank you.
William Piankowski, if I got that right or close to it.
Yeah. The nuns never got it straight. Thank you for allowing me to speak this evening. And my name is William Poinkowski. I'm the parent of a special needs person, developmentally delayed. What I'd like to talk about here is really the process. So the changes that have been made recently to the processes for people with special needs to hire support have been confusing, time-wasting, and not transparent. The system that has been in place works and is efficient. Now, OCHN controls all decisions. This adds a layer that didn't exist, and layers add time and confusion. I'm all for change to processes that lead to efficiency. We needed to onboard a new person for my son. In the past, this would have been completed in a month. The new person would have received payment during the approval period. That process is broken. We submitted paperwork in early May. Repeated phone calls to GT after several weeks were met with excuses and phone messages that were never returned. Next, the process changed, which involved recreating all the paperwork that was done the first time. Again, the wait went on, and no results. Repeated calls led to the same results after another month. Again, the process changed. New paperwork and promises that the system will work. That month passed. Repeated calls resulted in the identification that all approvals must be made by OCHN, and it was a bottleneck that did not come with, this will be cleared by X amount of time. It's obvious that OCHN is either short-staffed or unable to have a process that works. The approval chain was never communicated or mapped for the transparency needed to tell people what to expect. The stories run rampant over what and how things and what people have heard about lost pay without any explanation. The process needs to change, and people need to know what the steps are and what they will be paid. To retain the talent in the system today, their wage structure cannot change. Otherwise, there will be a mass exodus of capable people, which creates a larger void. My suggestion is the current people are grandfathered to the wage rate they had on 1/1 of '25. The decision process needs to revert to what the system did before the changes that have been implemented by OCHN. To speed the process, OCHN, in my opinion, should become an oversight group who would have the right to alter, change, cancel any approval. This step needs to be defined in writing and with the criteria and reasons for changes to an agreement. The staff at OCHN and GT need to be trained what to do and how to answer questions with a time-based period to deliver answers. This is not that complicated, and it allows for the organization to grow. Thanks for taking time to listen to my opinion.
Thank you. That completes the list, of individuals who signed up. Is there anyone else? Yes, sir.
Hello. This is on, right? Okay. My name is James Pierce. I'm part of a support staff, and I wasn't going to talk, but no staff came up, and I wanted you to hear from a staff's point of view. First off, even at the high wage that we make at the top end, it's barely a livable wage with today's income and market. $1, $2. What you guys are suggesting for me is 20% loss in pay. That hurts. That makes me have to make different decisions. It may make me have to cut hours, not be able to do this job. And I really care about this job. I've worked really hard to advocate for my increases. I'm PJ's support giver. I'm his main support giver. He has now won an award through you guys. He has been able to transition into having a job with a support staff, but have that. He has been able to move past every goal that we have set and have set new goals to get him further on. And it's because we take the time and work with him, and he has consistent staff. I've been with him for over 8 years. His other staff has been with him since the pandemic started. She got in there. And it makes no sense to cut anyone's pay. Anything I've ever seen in my life, a little history on me, I've ran quite a few restaurants and businesses before I decided to do this. I took a huge pay cut to do it. I live at the very basic of things because I care about this. But you do any more cuts to our pay, you're talking about me making the same wage that a full-time McDonald's worker makes, okay? Or a fast food worker. I believe I offer a lot more than what a full-time, just regular fast food worker, okay? And then you guys, we jump through hoops as employees. If there's an issue with our pay, oh my, is it the biggest thing in the world to try to figure out. The app that you guys have us all use, GT, is the worst pay app I've ever used in my life, and I've used multiple of them through different companies, okay? It has no way for you to check what's going on. They don't really communicate back with you. It takes forever to get anything done. And someone, like I just said, I've ran multiple businesses. A month to get an employee approved and put on. How can you run a business like that? How can you do anything that way? Now, I am not here to dog you guys, okay? OCHN has been great for everything. I heard through the grapevine things aren't the way that and pretty and nice like it be. But I tell you this, you cut employees' wages, you're going to be in a worse spot than you are now. And I don't want this to come off the wrong way, because I won't be someone that does that, but this will come down on your heads. You cut people's wages by 20% that do a job like this, it will get out in the public. And it will come down hard on you guys. And I don't think anyone wants to deal with it that way. There are way better ways to handle this and way better ways to make sure everyone moving forward is. I understand freeze of pay. I understand we're resetting a new start in wage. But if your starting wage and your main wage is going to be comparable to a McDonald's or a Taco Bell or any of those places where they can offer more hours, overtime, health care, vacation time, I get none of that. Okay? None of that is offered by OCHN to full-time or three-quarter-time employees that do this. Okay? But I bet you the administration people all above have it, above us. Is that really the way you guys want this to go down? I want to be able to figure out a way with you guys. I want this all to go forward and be great, because this has been one of the greatest jobs I've had in my life. This has been such a fulfilling thing. It has been amazing the people I have met through this. And I think more people need to be able to get into this profession and find out how great it is, because if you drop people's wages to what you're talking about, all you're going to have are glorified babysitters. Nobody's going to be meeting their goals and getting the things done that they're supposed to. And I'm shaking. I'm kind of furious, okay? I'm furious at how it's going down, and I'm furious that this was even an option to you guys. Okay? That's just what I'm saying, is it's an option. As employees, it feels like you're nitpicking at the people that you can. Not everybody else above us who makes probably more money than any of us do, get benefits and have all these other things, but they don't work with the client. We do. And we're the ones getting screwed. And all that does is going to make OCHN disappear. Because what point are you if you're not getting good staff to take care of what these people's needs are? Thank you very much.
Is there anyone else who wishes to address the board? Yes?
I would.
Oh, no, go ahead.
My name is Laverne Hill.
No, excuse me, ma'am. Ma'am, excuse me, we're first going to, we'll get to you, but first I'm going to cover people who showed up here in the audience, and a couple have raised their hand. I will get to the people online. Thank you. Yes, ma'am.
Hi, my name is Linda Houle. I'm a certified, I'm a competency evaluated nursing assistant and a caregiver and life coach. I started out working in nursing homes. I've worked at St. Mary's Hospital in Saginaw in the med-surg unit, and then the neuroprogressive unit and the neuro ICU. And then I worked in home care. All in all, I have 29 years experience. However unfair a pay cut would be to me in this economy, really, it will be even more unfair to my client. My client had a brain injury due to cancer. As a result, he has cognitive impairment, drop seizures, and will never be able to live on his own. I am the only caregiver besides his family and have worked with him for 40 hours a week for 6.5 years. He really could use at least one other caregiver to cover for me should I get sick, or so I don't have to feel guilty if I want to take a few days off. During these years, though, I have put out ads on social media looking for someone who would be willing to work with him too. I have never had anyone respond. It's hard enough to find someone to take this position, and now you want to decentivize it even more by lowering the wage in this economy? You are not just shooting yourself in the foot. You are shooting my client in the foot. Good luck with the exodus and finding qualified people to replace them. I can easily work elsewhere that will pay me a good wage. I get calls from people who know me all the time to do private duty home care for their loved ones. So I will be fine. But I can't say the same thing for the quality of life for my client or the many vulnerable people who can't live at home independently without caregivers. Mostly, This is not fair to them. In fact, this proposed wage cut is a grave injustice for the people that this company claims to help, and that's disgusting. Thank you for considering my opinion.
Yes.
Hello, everyone. My name is Courtney Gray. Ryan Gray, who actually has been a very, what's the word I'm looking for? A very, yes, he is an advocate. He's done a lot with OCHN. He's sat on many, many boards, helped with the right to vote, and get out the vote. He's won 1 million awards through you guys, as well as one from the state when Annette was here. I am his support staff. I'm not here to talk about the pay cut. I know you guys know nobody wants it. I'm not here to talk about the pay either. I'm here to talk about how OCHN has dropped the ball completely and how we can figure out a way to stop that from happening again. Okay? I found out the day before I was supposed to be paid that OCHN didn't approve my hours, even though I'd already worked them for 3 months. But yet I had a code to bill for it. And it was OCHN. It was not anyone else. It was because they went in and edited the wrong field on the wrong sheet with the wrong whatever, so nobody was alerted. And there I was. 3 months worth of pay not being paid. Can you imagine what that looks like when you do make not very much, when you do have bills, when you end up not being able to pay a bill because of a mistake you guys made? And I would love to say that that's just one time, but it's not. This is the second time. I have 2 clients that I work with, my brother and then Ian. This is the second time that this has occurred to me from you guys. Editing the wrong whatever or doing the wrong thing, and I don't find out until I'm supposed to actually be paid. And I don't find out from you guys. I find out from GT. That's kind of a problem. I understand there's a learning curve and you guys are doing what you can. However, I got a letter handed to me from my father, who's in the audience. He received a letter from OCHN that was in regards to the first time you didn't pay me. And it was dated for February. It was sent to the wrong address. It was sent to my father, who isn't even the client and has nothing to do with it, at the wrong address. And I received it 3 months later. Just an example of how there are some serious problems with what we have now. Let's not jump into doing more and more. Let's smooth out what we have now. Let's smooth out the different steps that we have to take and all of it. And this is just a little bit of what I could say. But it's really not working. And if it wasn't my brother, I wouldn't do this job. Thank you.
Okay. Is there anyone else in the audience? Yes.
Good afternoon. I don't know if this is redundant, but first of all, I'd like to thank OCHN for selecting me as a provider for the past 2 years. It's been a very wonderful experience. I am a provider, but we work with clients one-on-one as well as run our office. But recently I had some challenges, and I thought it was due to my own mistakes. Some of my clients I can't see in Odin anymore, and so I was wondering, where are they? So I found out that some of them are with GT Independence. And so we have to bill now using paper. And so we are billing blindly because there's no portal where we can see authorizations anymore, and we can't see how many units are left. And so when you call GT, they'll tell you, although you're the provider, we can't give you any information. You have to call the supports coordinator or the parents to find out the authorization, how many units are left, and so on. And so as I work with the supports coordinator very closely and I start billing them on paper, which they need a wet signature, so I have to go to each home and get it signed. And so invoices from the 1st through the 15th are due on the 16th. And if not, you won't be paid until the next cycle. And so recently I had some challenges where the authorizations were approved and in and uploaded on Odin, and I get a call from GT the day before payday. We can't pay you because we can't open the authorization. And so the supports coordinators and the clients were all on this email. It took weeks. We can't open it. So then finally I reached out to Self-Determination and OCHN. Veronica, very wonderful people. They jumped in and they were able to provide them with the proof that they needed to get paid. So this has been going on for like 3-4 months. I have an authorization that's still not approved from March 8th to April 7th for a 24-hour client that I still service. I'm paying payroll $70,000 every 2 weeks, and I'm receiving about $10,000 from GT. So I'm going backwards. And so I've been very patient. I call them, don't respond to emails. I email, I call, I just wait. And so again, we're back to a new pay period. I'm paying out $70,000, $80,000. I'm only receiving $7,000 here, $10,000 here. It's very difficult when you find out the day before payday that your invoices will not be paid. Going blindly invoicing is crazy. I have a client that was approved for 2-on-1 staff. I haven't been paid in 4 months because there's no drop down for GT to bill. They see the authorization is approved. There's no drop down in their system, so we can't pay you, Stacy. They just fixed the supportive employment part of it where there was no drop down. So we can't pay you for those individuals that are receiving supportive employment on their job because they don't have a drop down for it. They're waiting for IT to fix it. It's been 3 months. GT probably owes me over $100,000, and it's very hard and stressful to make my payroll. Knock on wood, I've never had to call anyone to say I can't pay you. Today I went to a home to get an invoice signed for 4 clients that are all 24-hour. The mom was so upset because she also works for GT and she hasn't been paid in 12 weeks. So she really didn't want to sign my invoice because I may get paid before she does. And so it's been very difficult. I am very patient. I don't complain, but eventually I'm going to be bankrupt. So I thank you for your time.
Yep. Is there anyone else who wishes to address, present here, wishes to address the board? Yes.
Hi, my name is Salma Begum. I am a grad student, and I started this like 3, maybe 4 years ago, after COVID when they had the incentive for the pay to be a little more. I have had only past experience a little with special needs. I have my bachelor's in social work, so I did feel comfortable with it. Even with that, throughout the last 3-4 years of working here, I have had to do so many researches and so many things, planning and finding information and learning different skills so that I can help the clients that I work with. I had all of my training previously done, because I've been with GT for a few years, recently had, in May, tried to start with a new client. All my stuff with GT was fully done. It still went till August 5th for me to finally have a code to come in. And before that, they had given me a code for a month for a temporary code. Well, all of my stuff just stayed in queue. And the parents had to actually pay out of pocket for a lot of the services provided so I could get paid instead of waiting, because GT, you guys, had kept saying there's paperwork that needs done or something needs done. We filled out so many paperwork repeatedly. And, you know, when you work with the clients one-on-one, it makes a difference, the consistency, how long you're actually with them. You learn what actually can work with them, what can't, and all of that takes time to even build a rapport with them. You're in their personal space often, and to create that rapport and build it, and then they have that, you know, stability. And, you know, when you're reducing pay for us, we're already doing so much. You're reducing our pay. What are we supposed to be doing? GT sent me back so many of my timesheets, and they're like, you need to redo it because our code doesn't now allow us to see where you went, so we need you to write that in your notes. That took me 2 hours to redo, I think, like over 20 for between the 3 clients I work with. That 2 hours was unpaid because of a change code that I wasn't told. I was never informed by them that it was different processing. We've been supposed to get updates on our apps to make, you know, timesheets, to make mileages easier. That has never happened. We have barely gotten communication. It's hearing about it from our, you know, the case managers, from the clients that, oh, your pay is going to be now messed up. And that hurts to see that, like, we're, getting paid around 20 if even, and now you want to reduce it. In this economy with the inflation, how are we supposed to support ourselves when we're trying to support our clients? I don't think that makes sense. And that's about all I wanted to say.
Okay. Thank you. Is there anyone else present who wishes to address the board here? Yes.
My name's Patrick Gray. I'm Courtney's dad. I'm not going to say that I know exactly what's going on here. It seems to me that there is a problem with GT or GF Financial or whoever it is, and there's obviously a problem with your organization relative to coordinating the benefits that are supposed to go to these people. It just seems to me that if your mission is to help the disabled, the only people who are actually on the front lines providing the services you're supposed to provide are these people that you're talking about here, taking a pay cut. It seems to me that that would be contrary to what your mission is. You should be supporting these people to the fullest extent, because you can't do your job as an organization if they're not here. They're the ones providing the support. No one else up on this board, as far as I know, is providing the support. That's all I want to say. Thank you.
Anyone else? There being no one here present, we'll now go to anyone who may be online.
If you are online and wish to speak for public comment, please raise your hand at this time. The first name I see is Jennifer.
Hi there. My name is Angelina. I'm just using a different phone to speak. I am speaking here today as a support caregiver for 2 autistic nonverbal teenagers. Over the past 5 days, I've received 10 emails, basically harassing me to sign this new contract accepting a lower pay. I received no communication whatsoever regarding the situation directly, only from the family I support who also got barely information at all. What is even more shocking is that they have deducted my pay $4 for one child and $3 for the other, while also limiting the amount of hours I can work. To not even get paid the same amount for each child is ridiculous. OCHN has no idea what happens in every household because every situation is different. Since the emails and me refusing to sign them, GT Independence has also stopped my ability to even clock in for hours. For OCHN to tell the family that both of their kids will not be equal in the attention they are giving because caring for one child pays more is absurd. After speaking with GT, they told me that they would withhold my pay until I signed the contract, which is illegal. OCHN has yet to give me a call back after I filed a complaint. It breaks my heart, but how do you expect someone to live off these deducted wages when working at Taco Bell pays more? I devote my time to this community because I have love and care for the kids I look after. It would break my heart to leave the family, but what other choice do I have when I need to live off a livable wage? The family I work for has spent so long trying to find qualified people for both of their children, which is a very big struggle, and now it's going to be even harder for everyone in the community to find support. OCHN is putting families at risk, and it's truly a devastating situation that needs to be rectified. Thank you for the opportunity to speak.
Thank you. Anyone else? No. Okay. All right. That is the end of the public comment. There's another opportunity for public comment at the end of the meeting. So for those who have come out tonight, we thank you for coming. We do not vote or take any action on things that come before us for public comment. So as a result, we're going to take into account what you said. I'm going to talk to Dana, or we will, and get back to you on these issues which we know are important to all of you. Okay?
I have a quick question, please.
Sure.
We hear we will get back to you all the time, and it takes forever. Can we have like an idea of when you're going to be transparent with this stuff, and that you will be talking to us and giving us this information? Because that's what we go through on a daily basis with being in this, is we don't get the information.
I wish I could. I can't. Yes, I'm not going to be, no, I can't. I'm not going to tell you I'm going to do something and then not do it. I will.
Wait a minute.
No, sir, excuse me. Excuse me, no. No. You're out of order, okay? I'm sorry. You asked me a question, I answered it. I know it's not the answer you want, but that's the answer, okay? We're gonna move on.
I'll leave, I'm sorry.
Thank you.
But you did not answer it.
Okay.
Don't pretend like you're doing something when you're not.
All right. We'll move on now to stories that inspire hope. And Suzanne, if you could introduce our guest this evening.
Yep. Yeah, sure. Good evening. It's my distinct pleasure to introduce Amit. Amit is not only a person served, he is an OCHN trainer, and he's also a very strong advocate for the behavioral health system. That's evident. He was actually on our panel yesterday for our town hall, and he did a fabulous job telling his story and also sharing his message to support the public behavioral health system, keeping it public and keeping it local. He also, and just so you know, we had well over 200 people in attendance at that event, both in person and online yesterday. So it was a well-attended event, and we were grateful for Amit to be one of our panelists. He also recently served as our dynamic host for our Your Voice, Your Value event earlier this month. So we were grateful for his part in that event. And he's also provided some very valuable insight. He was part of our work group for our new website that is coming soon, coming this fall. So he was able to provide some valuable insight for that as well. So we're grateful for his feedback on that. So without further ado, it's my pleasure to introduce Amit for him to tell a little bit about himself.
All right, well, thank you, Suzanne. And thank you, OCHN board members and audience members in the room and online. So I spoke to this board a few years ago, and I talked about how, my work has really enriched my life. But I'd like to kind of spend a few minutes today to talk about not only how work has enriched my life, but other activities. So next slide, please. Oops. So my talk for today is called, the benefits of the impacts of physical and the benefits of enriching activities on my physical and mental well-being. So next slide, please. So I'm going to share just a few snapshots of the activities that I'm doing because, words are easy to say, but, it's cooler to see in pictures. So next slide. So this first picture is of me in the pool. I was able to eventually, over time, walk in the pool, and it really not only helped me physically, but made me feel good that I'm able to move around and do stuff. And this second picture that you see, I'm on a adaptive tricycle, which also allows me to move my muscles and makes me feel good because I feel that I accomplished something, and exercise just feels good. So next slide. And this next one is me just doing more working out. I can't stress enough the benefits of working out. And of course, my position here at OCHN, this picture of me just, at one of our providers, providing one of our trainings to individuals that we serve. So, that makes me feel that, I'm helping the community and makes me feel like I have a purpose. Next slide. And this last one, I recently did this at an Abilities Expo in Chicago, and I got to try adaptive wall climbing. So see the first one, I'm getting ready for it. And the second one, I'm actually putting myself up on the wall, which looks easier than it actually was. But again, that sense of accomplishment was, I can't even describe that feeling. That was just amazing. I mean, I was tired, but that sense of accomplishment is amazing. So next slide. But none of this is possible. Doing any of these life-enriching activities is not possible without a strong support system. Next slide. So here's just a little bit of a breakdown of my support system. I got my family and friends, and I've got, of course, the public mental health system. I've got North Oakland Transportation Authority. They really provide a wonderful service to our community and allow me the ability to work and be part of my community. And last but not least, I've got my amazing coworkers here at OCHN. Next slide. Before I take questions, I do want to add something. I know that there's a lot of uncertain changes, with all the system changes. But we want to make sure that we are looking at our direct care staff, because I really feel that they're the safety net for the people that we serve, and myself as well. So with that, I'll take any questions or comments from the board.
Yes, Dr. Guadalupe.
Not a question, just a comment to say thank you for all that you do in the advocacy work. It's a pleasure serving with you on the RRAC. You bring up a lot of great points, and I just think you're a great advocate for the community. And you did a great job in these last two events that you hosted and were a part of with the town hall and the Your Voice, Your Value conference.
Thank you, Dr. Guadalupe.
Yeah.
I'll just echo hearing you speak last night in that large audience. You did a good job of bringing home the story that is very complex and hits at the federal, state, and local levels. So
Yep.
thanks for doing that, being here 2 nights in a row.
Yep,
Appreciate
thank
it.
you. Well, thanks for the opportunity.
You're earning your frequent flyer miles here. Anyone else? Dr. Hunt?
Yeah, I first met Amit at the RRAC a few years ago. He has been a consistent voice for families like me. My son, who has developmental disability, is a verbal autistic with lot of abilities, but he has a very severe language processing deficit. So whatever he wants to say, he cannot express in words. So Amit, I want to congratulate you for all the advocacy work you do for people like my son who cannot speak for themselves. Thank you very much.
Thank you, and thank you for the advocacy that you do for your son as well.
Yes.
Hello, I just wanted to make one more comment. What I heard from you that really resonated with me was you said you felt a sense of accomplishment. And when I heard you say that, I asked myself, how often do we do anything and we feel a sense of accomplishment? And I think it's amazing how you, as an advocate and also a person served, just shared with us how your support enabled you to engage in activities that gave you that sense of accomplishment. So I thank you for that because it really resonated with me. It's important that we continue to provide opportunities for our person served to have that sense of accomplishment. Thank you.
Thank you so much.
I was at the Voices event that was a couple weeks ago. You were the Master of Ceremonies. You did a wonderful job, and I appreciate the efforts you make in all the things that you do with OCHN, so thank you very much.
Thank you. And I can't take all the credit. I have to give a lot of thanks to Suzanne and the whole OCHN staff that I get a chance to work with. They're really amazing. I know we're all going through a difficult time, but, they do amazing work, and they really support people that we serve. So thank you.
Thank you. All right. Thank you very much.
Thank you.
The next item on our regular agenda is my report. As I mentioned at the meeting last week, I did attend the Voices event where Amit was the Master of Ceremonies. It was a great event. Our staff did an absolutely great job in the opportunity to honor a number of people that we serve who have made some significant accomplishments in their lifetime and in the past year. So that was, I was very glad to attend that event. I know Mr. Young and Dr. Guadalupe were also able to attend, and that was a good thing. So that being said, we continue to work with the other networks in opposing the MDHSS director's proposal to significantly change the delivery of mental health services. We think that is a mistake. It'll cause severe disruption and a reduction of money in the system. And we have fought these efforts before to privatize the delivery of mental health services. And here we are once again. I think this is the third or fourth time since I've been on the board. We are the voice for the 30,000 people that we serve, and we will use that voice along with all those who want to join us in opposing this move. So at that, we have coming up, I think it's on Thursday, we have a tri-county meeting with Macomb County is actually the host, but they're hosting it here. So we're going to be meeting with staff and board members of both Wayne and Macomb to discuss the situation, as I believe we're still in the application period right now. So I don't think everyone appreciates how devastating this is going to be to the system. Not certain why this was even put forward, and came as quite a shock to all of us who work in the mental health system here in Michigan. So we'll continue those efforts. Some are behind the scenes, some are out front with our other colleagues, and so we'll be having this meeting to continue to pursue a course of action. We have received tremendous support here in Oakland County. The Board of Commissioners passed a resolution in opposition, along with our county executive, who has voiced his opposition. I think we may be moving to get support from many city leaders and township and community leaders here in Oakland County as we move forward in the process. So we always like to be for something. We're for the full funding of mental health services here in the state of Michigan and Oakland County. It's unfortunate that we have to be against something, but we are against this proposal from the director. So that being said, we'll move on to our regular agenda, and the first under board approval items, and the first item we have is a recipient rights appeals committee reappointment of Hunter Parker. Do we have a motion?
So moved.
Support.
Motion and support. This was presented to us last month, and we had an opportunity, or last week, we had an opportunity to review it. Is there any further discussion? There being none, if you want to take the roll.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Giles?
Yes.
Pastor Jones?
Yes.
Dr. Guadalupe?
Yes.
Dr. Hans?
Yes.
Miss Root? Yes. And Mr. Smith?
Yes.
And Mr. Cowan?
Yes.
Motion carries.
Thank you. The next four items that we have are all contracts that have been brought before us for action. I do want to let the public know, so I only have to say this once, that each one of these contracts we went over in our committee of the whole meeting last week, and there were presentations. We won't duplicate that again, but I don't want anyone to think that we merely just approve everything that comes before us. It goes before our finance committee, and then they make a recommendation to us, and in each instance, these four have been recommended to us for approval. So first we have the UHY Advisors Great Lakes. This is our HIPAA security compliance contract.
Move for approval.
Support.
A motion and support. Is there any discussion? Yes.
Yeah, I just want to add to your comments, and that the committee of the whole, as well as all the meetings, are recorded and are available on the website. So if people in the audience or people in general want to review our deliberations during the committee of the whole meeting, that is available for them to review. Thank you.
Thank you.
And Mr. Chairman, hopefully that also, with that approval, I know the doctor had made some suggested corrections in tracking, that's included as well.
Yes. I believe it is. Yes. All right. Roll call vote, please.
Mr. Smith?
Yes.
Miss Root? Dr. Hans? Dr. Guadalupe? Yes. Pastor Jones?
Yes.
Dr. Giles?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Next is the Prest contract, and that is for a physician advisor that is utilized by OCHN for all medical necessity denials. And this is something that's needed under state regulation. So do we have any action? This is a 3-year contract.
Move for approval.
Support.
A motion of support. I just wanted to mention this in the amount of $252,000. So that being said, we have a motion and support. Is there any discussion? Yes, Mr. Smith.
Yes, first of all, I think it's a not to exceed amount. Is that my understanding? Contract?
Yes,
And I
that's
think there was
correct.
an outstanding question from the committee of the whole as far as how many reviews they did last year.
So this fiscal year, we've done so far 150 reviews, 130 were denied, 20 approved. Last fiscal year, we had 73 by press. It's increased quite a bit because last fiscal year, we still had our PhD reviewer. And if you recall, this past year, she stopped working for us in January. So that is why the contract has increased so much, because we've had to utilize press significantly more. Oh, I'm Jasmine White, sorry.
Oh, I'm sorry.
I apologize.
Okay. No, you're fine.
Yeah.
All right. Any other questions for Jasmine? Okay, but thanks
Yeah,
for
no problem.
bringing that information forward. We appreciate it.
Any others?
Is there any further discussion? Roll call vote, please, or roll call taken, please.
Mr. Young? Mr. Furman?
Yes.
Dr. Giles?
Yes.
Pastor Jones?
Yes.
Dr. Guadalupe?
Yes.
Dr. Hahn?
Yes.
Ms. Root?
Yes.
Mr. Smith?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you. Next is our Teledoc contract, and that's an online mobile self-management program, and that we have used before, and so we want to continue that. This is through February of next year. It's $43,500.
Move for approval.
Support.
Motion and support. Is there any discussion? Roll call, please.
Mr. Smith?
Yes.
Ms. Root?
Yes.
Dr. Hans? Dr. Guadalupe?
Yes.
Pastor Jones?
Yes.
Dr. Giles?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Next is a contract with LJ Rolls, and this is to extend for another year. Our current contract with this company for maintenance of our HVAC system in this aging building. And so the purpose for the extension is that we are working with them to develop a plan and a budget for replacement of the HVAC system. And it's best to continue with this company rather than bring somebody new in at this time, given the situation that we find ourselves in. So that was discussed last week.
Move for approval.
A motion and support. Is there any discussion?
Just a note, it's 11 years beyond the useful life, so we're going.
You're talking about the board or the system? No, only kidding. All right.
I'll let Mark answer that if
Right.
I'm online.
All right. So there being no further discussion, roll call vote, please.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Giles?
Yes.
Pastor Jones?
Yes.
Dr. Guadalupe?
Yes.
Dr. Hans?
Yes.
Ms. Root?
Yes.
Mr. Smith?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you for taking all those votes for us, Sheila. We appreciate it. Next is our consent agenda, which is minutes of various meetings, including our board, Committee of the Whole, Citizens Advisory Committee, and SUD Oversight Policy Board.
Move for approval.
Support.
Motion and support. The consent agenda is not a discussion item. All those in favor say aye.
Aye.
All those opposed, the motion carries. Just want to note for the record, we do have receive and file our June 2025 financial report, also our performance indicators for both the first and second quarter, and then the zero suicide presentation that we had last week also. Is there any other business that any board member wishes to bring before the board this evening? Or our director? Any other business?
No, nothing I won't have in my report.
In your report, right, okay. Next, board reports, we have Citizens Advisory Committee. Christina?
I presented on the July meeting last month, and then our August meeting has not happened yet. It's tomorrow morning.
Okay.
So no report. Thank you.
And, well, you got a busy week with meetings with OCHN. So, next, just for the record, Ms. Woodruff, who's on the SUD Oversight Policy Board, is not here this evening, but she did submit a written report, which the board has had an opportunity to review. Did anybody have any comment on that report or any questions? Okay. All right, thank you. Now is the opportunity for a second opportunity for public comment. So I will first ask anyone who's present here if they wish to address the board. Yes, sir. And again, please state your name and please limit your comments to 3 minutes.
My name's Justin Thorne. I appreciate you taking the time to listen to me one more time tonight. I just wanted to say that in regards to one of the staff who came earlier who was upset as he departed, the challenges that a lot of the staff face is the deadlines to sign these contracts for some of them are as early as Thursday. I know that someone online said that they've already faced a deadline, but I think for multiple people it's as close as the end of August. So I think their pressure for time is just based on that decision that is hovering over their heads. And I wanted to reiterate that I take responsibility and accountability that I was a major organizer of asking people to come out and speak tonight. And that was only on a week's notice. I started talking to people on Tuesday about who'd be willing to come out and advocate and speak. And I'm willing to pledge myself to help you against the privatization of Medicaid in this area. I came to the town hall yesterday. I learned a lot about what could be happening, but I can't help solve next year's problems when I have this year's problems to deal with. So I just want to ask again to deeply consider the things that we're asking for, the grandfathering of rates for existing staff, and for transparency regarding the rate changes. Thank you so much.
Thank you. Is it anyone else who wishes to address the board this evening here in the audience? Yes.
Oh, sorry. Okay. William Poinkowski, I just wanted to come back up to offer my help as an independent citizen to help your organization to overcome what we heard about funding our people that help our special needs people out, as well as, you know, it seems like the system is broken and there's a lot of things that need to be fixed. I mean, you know, in industry, software tools are widely used. All of our people know how to use them. It seems like there's, you know, an IT thing that needs to be addressed here, because I know the GT system has been pathetic for, since we started using services for my son, and there's got to be solutions here. And you could feel the emotion of the people that have spoken so far. Hopefully, you know, that means something to the board, that we can move quickly to show that there's action here. I mean, the worst thing is when you don't have transparency. I've served in city government where I live, and, you know, community people need to be able to feel transparency. If you don't feel it, you know, then anger results from those things. So if you need help, I'm willing to help and do whatever to help forward what we're trying to get done here. Thank you.
Thank you. Is there anyone else who wishes to address the board here this evening? There being no one in the room, is there anyone else online?
If you are online and wish to speak for public comment, please raise your hand at this time. Salim, you can go ahead.
Yes, thank you. I just want to go ahead and just talk about how there's so many different things that OCHN funds. And to go after people who are just desperately struggling to survive on the low pay that they have to get even less pay, there's just got to be a better way to get funding. There's a lot of great people who are not going to be able to do this job anymore. And if you could just take the perspective of someone who depends on their caregiver and they see OCHN already doesn't have enough funding to pay them as much as they deserve it, and then reducing it, it's terrifying, and it just really stings. For example, this month, there was the bonus for your executive director. It just doesn't make sense to have a bonus, another bonus. I've lost count of the bonuses over the years, for the executive director while taking funds from the people who are the most important people for in the lives of people with disabilities. And there is just got to be different ways to get the funding. There's so many things. If you look down the list of everything OCHN pays for. So I just want everyone to appreciate that OCHN has awesome people working for them. They're people who, of course, they have to get college degrees. They have to pay all to get their degrees, and that's really expensive. And I understand why they would make usually more than $100,000 a year. But if you could just think about how difficult it is to get by as a caregiver, it would really hopefully change your mind on this. And thank you for taking the time.
Thank you. Is there anyone else online?
Jennifer?
Hey there. I just have one more thing to say. My name is Angelina. I'm a caregiver. Just to recap, are the families not going to receive support while you guys figure this out because you won't let your employees clock in under the old code to get paid? I just don't understand. You're hurting so many families. What am I supposed to do from here if I won't get paid to work? And what about the families? What if no one shows up the whole rest of the week? Like, you're cutting off support to families because you won't pay your employees under the old code because they're refusing to sign the contract. I want to know what I'm supposed to do like the rest of the week until this gets figured out. Um, and then from here, I'm going to give this to the head of the household that I care for, Jennifer.
Hi, everyone. I just want to let you guys know how hard it is as a parent to have a nonverbal child and to find someone to come care for them. It is beyond difficult to find someone who's honest that you're going to leave in your house, who's not going to abuse them where they can't tell me they're being abused. It's so hard to find that to cut pay. They can go work in a library and have the easiest job in the world. A regular plain babysitter makes more than $25 an hour and they get paid cash. It's so easy to find someone for a normal child. It's very beyond difficult to find someone for a child with special needs. It's super, super hard. I wish you guys would actually pay attention to what we're saying and try to change this. Thank you.
Thank you. Is there anyone else online? Okay. Thank you to those who came out and spoke. That will close the public comment, second public comment this evening. And now we have director's report, and I'll hand it over to Dana Lazenby.
Thank you. And I have my report, but I cannot sit here and not address some of the things that we heard today. And I do want to say that I hear the comments, and I'm committed to addressing the concerns and issues that were expressed tonight. So tomorrow morning, I'll be meeting with our team to set aside this as a priority so that we can address the issues that have come up today and the things that we've been working on and hearing about for the last few weeks. So this is a complex issue, and the last thing that we would ever do is commit or change something that would take away funding from a direct care worker and put at risk the services that people are receiving. So we are committed, as our team is committed, and be assured that tomorrow morning we'll be working on this as a priority, and we will get out communication to you all as soon as possible. So I wanted to start with that because we can't sit here and not address that. That is critically important as a leader of this organization, but also as a mom. So I want to make sure that you understand we heard you, we respect your opinions, and I thank you for sharing these things. Some of these things would not come to us the way that they did tonight if you had not come forward to speak to us. So I hope that the board is okay with me having that comment, because I think it's important that can't talk about your voice and value, which we're really excited about, and not address the concerns in the room and in the community. So with that, I'll finish with my report. And in advance, thank you all for everyone who showed up yesterday, either virtually or in person. We had about 180 participants, I think at least online, and maybe 75 in the room. So it was a great turnout, and it's for a good cause. I would say the system is not broken, but there is a lot of opportunity for improvement, right? And so I could go on and on about the RFP, but I won't. I just want you all to know that this is something that puts the public system at risk. And again, it is written in a way that it would make it very difficult for us to respond. Our plan is to respond, and we will do so before the due date, which is September 29th. These changes, which we discussed yesterday, have a huge impact on, one, how the regions are defined in terms of taking 10 regions or 10 prepaid inpatient health plans and making them into 3. It will require us, OCHN, to merge with Macomb and as well as Detroit Wayne is one of those possibilities. We are working with our partners to see what is the best option for us in terms of responding as a group or individually with supporting one another and how that would look. The other thing that I will say, and one of the concerns we have, and it's a big one, is that the federal changes and the reductions to Medicaid funding have not even a trickle down, a huge impact on our ability to provide those services and supports. So however you define or align the system or reform the system, it's going to impact all of us, and it's going to hit us hard. When you have Medicaid dollars, you have to serve the most vulnerable. So there's like a pie, and part of that pie is primarily that your Medicaid dollars go to those individuals who are in crisis, and then the second circle within the pie is individuals with a serious mental illness, children with serious emotional disorder, individuals with intellectual and developmental disabilities, as well as substance use disorder. And from there, everything else is, if you have the dollars, then you can serve. And I think we all understand the critical importance of our direct care workers within the system and their pay rates. And we're going to continue to advocate for meaningful wages, but also think about the individuals that we encounter who are not engaged in services but need those services. Individuals in the schools with our school mental health navigators, individuals that we support who are veterans with our veterans navigators, as well as our co-responder programs and our justice programs that really divert people from jail and get them into services and supports. And sadly, we've become pretty much the call on experts for behavioral health or behavior threat assessment and management. And so those are the programs that are truly at risk when you lose Medicaid dollars and you have to use your general fund dollars to serve, but also at a time in our country and in our state where we're struggling to maintain the funding that we know is needed for an underfunded system. So again, those challenges are ahead of us, but we're up for the I guess, the fight. And as our chair said, we are solution focused. So we want to look for solutions. We don't want to just say we're complaining about the RFP. We are looking for ways to solve this problem in a way that keeps and maintains the public system, maintains the public control in the way that the priorities of our system remain the priorities of Oakland County and the residents of Oakland County. And I think that's the other thing that's lost. This board would be at risk, as well as our Board of Commissioners and others, to have a say in the services and supports that we prioritize in this community. But also, what we heard earlier is an example of community mental health. For the people who are a part of receiving services, they should be a part of the design and implementation of those services. So those type of things are lost when you privatize the system. So I just wanted to reiterate that a little or a lot, however you look at it. But seriously, we prioritize the public system, and we prioritize the individuals who work in the system, and we want to make sure that we can continue to provide the quality services and supports, and that people have the resources that they need. The other things that I'll say is there are a lot of data in my report, and please feel free to ask any questions about that, but I really want to focus in on the priorities at hand, and that is really to address what we see is, and what we heard this afternoon from the citizens of our community, those working and those receiving services, but also this RFP and our attempt to advocate, strong attempt. I have to look at my team members and say, everybody's really working hard, our sleeves are rolled up, and we're ready for our challenges. And we appreciate the support of the community. We appreciate the gentleman who said, even though, you know, we have an issue right now, that they're going to continue to work with us and advocate for the public system. So with that, I'll stop and see if there are any questions.
There are, because we know what issues she's dealing with every day, and we're dealing with them too. So, but I appreciate the report.
Thank you.
At this time, we have the opportunity.
Well, what we heard today was quite sobering, but I just want to reassure that we are here and we will try everything we can to support the community. I can speak for myself as a family member, but also as a board member, that every member is dedicated to why they are here, and they remember every day how important it is to do the work that we do. But in this, we need everybody's help. I think we heard a lot of voices, and these people can also be the strongest advocates for our system that supports so many people in this county. So thank you for your comments, and please be assured that we are dedicated to what we're doing here. Thank you.
Similarly, I'd like to thank everyone who made public comment tonight. It truly, truly does help us board members with knowing what's going on, staying informed, and then to be able to ask the questions that it's our job to ask, right? That's why we're at this table, to be able to understand what's going on, shine the flashlight on issues, and help be part of the advocacy efforts to improve things. So as part of my comment, I would like to ask our OCHN staff, I know you're already so busy, but if we could get some follow-up to the board, just with more clarity of what this issue is, because I'm sitting here feeling kind of confused, hearing some contrasting messages. So I would just like to understand a bit more, maybe the timeline or how we do the one-page bullet point sheets to simplify information about changes and issues going on. If we could please get that soon in an understandable time frame. And that's all. Thank you.
Thank you, Dr. Hahn. And saying what we heard tonight was very sobering. very touching for us. And you know, there's thing, you never know a person is drowning unless they cry out for help. And so when you cry out for help, then the idea is what type of lifeline do you throw to them? How do you fix that situation? And certainly, I would say on my part, I'm sure on the board, we heard the cry. We heard the call. I thank our leader, you know, our director, Dana, said, okay, tomorrow morning, we're going to do something, you know. So it says we're not letting this go unanswered, unheard, or unresponded to. Don't know what the solution, what all the alternatives are, what they are, you know. Don't want to promise something that can't be delivered. But one thing you can walk away with is that we're going to look at it. We're going to see what we can do. And that's very, very important. Somehow or another, we try to bring you to the shore, okay? Try to bring you to the shore. But tonight, very, very sobering, touched all of us. I took notes as well to follow up, to see, okay, what do we do? How do we do this? Okay, how do we do it? Okay, and that's important, and we'll get back to you on that. And I thank this board. I thank everybody. I thank you all. And the gentleman that left, you know, I've been there. Okay, I've been telling him I've been there, and so I know how he feels. But we'll get it together. So I want to say thanks, and I want to thank gentlemen that spoke to us. Accomplishment. And I watched that, and I said, even seen him climb the wall, okay? Climb the wall. He overachieved. Proving nothing is impossible. And so let's see what we can do. But thank you very much. Thank you, board. Thank you, Dana, for, you know, committing to that. It starts tomorrow. I'm sure to many of us, it's starting tonight.
A couple of notes. It was good to see Ahmed. It was, as you said it well, I think the climbing was very symbolic. It's also good to see PJ. I'm assuming that's the PJ from Dutton Farm and Rochester Hills Library. I recognize that face. Good to see that there's a young man who's achieved a lot. Pardon? That's what I thought. Yes, it's good to see him. So.
Thanks again to Amit, always a very strong advocate and an eloquent advocate as well, so thank you for that, as well as his numerous accomplishments that he attained just by living his life. And I'd like to echo the sentiments of my other board members tonight. Your public comments were very affecting, and yes, let's get to the bottom of this issue and find solutions, because the caregivers are the lifeblood of the system. So thank you all for coming out, and have a good night.
Okay. Thank you. You took me off there. I'm sorry. Thank you. I got to think about why you congratulating me, but thank you. Okay. Oh, thank you very much. It came to me. I'm sorry. I was struggling hard not to repeat everything that everyone said. So when you said that, I'm like, what? Oh, no. No, you're fine. Thank you. And I'll tell her thank you as well. And continuing with my thanks, I don't want to repeat what everyone said, but I do want to thank the young man that came and said, hey, I coordinated all of this. I appreciate it, because I'm sitting over here with a page of questions and don't know where to start with the answers. And I thank our director who said tomorrow, you know. So although she didn't see my questions, she's already anticipating, heard you all. So thank you all that came on his calling. But she heard it, and she's already ready to go to work. and I appreciate her for that, and I expect nothing less. I understand it's very difficult time, very difficult. And then I want to thank my fellow board member, Ms. Root, who said also, can we get a bullet point? I'm confused. Can we get some answers for this? And then, of course, to thank the young man that came and spoke. I still say that sense of accomplishment. So I do hope that at the end of all of this, the RFP, the changes to wages, I hope that we all can feel that sense of accomplishment that we have overcame these many, 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 many struggles. I really do. Thank you all.
Like Dr. Giles, I am struggling to not be repetitive and also realize I won't be as articulate as all the public speakers tonight who were excellent. And all this is new to me. And being on this side of the table, please understand that we are public board members that are here because we're passionate about serving the community and you. And we need to give ourselves times to educate on these issues and understand it before we comment too directly, which is tough to do. But please know that you are heard. And I'll also say to the board that I do know some of these families from work in the community, and I will say that they're not zealots. Their offers to help are very sincere. They do understand, money was flowing during the pandemic. I've never heard one of them for privatization. I'm sure they understand and are reading about the big, beautiful bill. They get the headwinds that are coming, and so I think it's important for us to not be patronizing to them, to suggest that we don't understand that they don't understand that. They understand those challenges we face. And it reminds me of, I don't know about you, Mr. Callen, but the best advice I got in law school, and probably could have skipped law school, is the answer of no, but. That has served me so much in my legal career in telling clients, we can't do that, but we can look at other ways to do things and other solutions. And there's just, no excuse for us to not give people notice of changes, not offering the budget, not ensuring there's due process, which is just a legal term for being humanly decent, reduce bureaucracy, ensure there are thoughtful transitions. We owe the community that, and we need to ensure that either we or our providers are offering that and providing those opportunities. And I also want to make sure the board's aware, during the pandemic, there was a case called Wasco versus Washtenaw County. It was a Sixth Circuit Federal Court of Appeals case, and we, in my world, don't see Sixth Circuit Federal Court of Appeals cases. And the case can be basic, and it was Washtenaw County CMH, so it was basically our equivalent of Washtenaw County getting sued. And the basis of the Sixth Circuit case and some of the opinions around it can be summed up to this, is you can pay people so little, that you are effectively institutionalizing them. And that's what the courts in Washtenaw County was accused of doing, and that is what the state ultimately, settled on, and something that is, I think, part of this conversation. And I will say some of the things that were being said tonight don't make me proud, because there's no way that I want to be on this board where you replace Washtenaw County with Oakland County. I mean, for all of you U of M fans, I want to be better than than Washtenaw County. And, I think we should strive to do that. And I appreciate, Dana, you saying that, we'll put our full attention to this, and please know that I'm, as a board member, will be dedicated to whatever we can do to address these questions. And I'll just add that, I think Dustin, one thing that he said that I do think is appropriate, if we need to give extension on these contracts to give people time, let's start there, because I know we're loaded with this RFP process, and I know I couldn't advise a client to sign these contracts in some circumstances. I don't know enough about it, but you can't just shove a big piece of paper in front of them and say sign when there's all these questions. So if there's a chance that we can buy some time with extensions, I would encourage that, not knowing any more about it. So thank you.
Hard to follow all these comments tonight, but I will just share. as a social worker and an educator, one of the most important things I try and articulate is advocacy, and I think I saw that tonight, which was great to see it in practice. So thank you to everyone that did come up to share their stories. It definitely got us all thinking. I was too going to ask for some type of, similar to what Ms. Root asked for, specifically in that if you could put something about this GT independence, because it sounded like that was, I mean, there was lots of themes, but it does sound like a big barrier. So whether that's a document to us or some type of presentation you can give, just I'm curious on the interface and if problems have been noted and how we're addressing those, please. Thank you.
Thank you. Just a couple points. First, I want to thank all those who came out to speak, and they spoke with passion, and that's important. We share that passion. If you don't know us as a board, most of us have family members who receive services, so the decisions we make affect us as well as other families, and we understand that. We have a fiduciary responsibility with the state, federal, and county funds that we receive, and unfortunately those funds are diminishing, and we try to do the best we can to serve approximately 30,000 individuals. We have administrative costs of around 6 to 7%, which I would match against any nonprofit organization in the state of Michigan. We don't have a broken system. We have an underfunded system, and we're doing the very best we can under very difficult circumstances. That being said, I've heard a lot said tonight, and I'll divide the issues into two buckets. One is administrative, and the second is the issue about future dollars. And I think, I'm going to leave it to Dana to sort some of that out. I think it's safe to say, though, OCHN does not determine pay rates. We don't cut pay. We don't set pay rates. So I think, that's one issue I wanted to make sure got on the table. The other thing, though, and I'll ask Dana, in terms of priorities, and I think Chris mentioned some of them, but the number one thing is we have to pay people what we owe them. So I don't know how that happened. I'm sure there's an explanation, but let's make sure that is a priority. Let's get people paid for money that we owe them, and if there's some administrative glitch, we're going to have to work through it, waive it, as long as we have justification and to be able to pay people, let's get them paid. That's number one. They've earned that ability. The second priority would to me, immediate priority would be this contract issue, and if we can extend some of that to give people a little bit more breathing room so we can sort some things out, then let's go there. And then in the mix also is going to have to be the issue about the request for some reinstitution of funds. And that's, I know, is going to be a very difficult issue because we went through a long process on fee for services, but let's take a look at it in this instance with this particular situation, and we'll await the recommendation. Okay? That being said, we now come to the conclusion of our meeting, and we stand adjourned.